Hey there, it's Hoang with Hand Therapy Secrets. Welcome to my show, The Hoang Show. It's Wednesday, and I want to share with you some amazing therapists in the hand therapy world. Whether you're an occupational therapist or a physical therapist, if you are killing it in the hand therapy world, I really want to meet you, get to know you, and share your story. So today's story that I had the pleasure of meeting, she is an occupational therapist and certified hand therapist with tons of experience in hand therapy. Not only does she have her own private clinic out on the West Coast, but she also teaches online live courses, and Saba's going to tell you all about what she does in this interview. Now, the whole point of my show here is to inspire you, to help you develop your skills and grow your confidence in hand therapy. So I really do hope you enjoy these episodes where I have the pleasure of meeting people that I normally might not have a chance to talk to or meet. So I hope that you get the most out of these interviews, and if you have any comments or questions, just leave them in the comments below. And if you have great things to say, if you love everything that Saba's got to say, the links to her courses are in the description below.
So what made you start these things?
This show, the Hoang Show,
Yeah.
I started it because I wanted to continue to share more and more information for the people who are following Hand Therapy Secrets. So I started Hand Therapy Secrets as a training program. Okay. I don't know about you. You have clinics, right? So I have a clinic. You have two, right? I have one, but it's really hard to find people who have certain skills in hand therapy. Mm-hmm. And so in my area, I keep hearing it. I mean, I've been hearing it for like a million years. I myself have done this where, like, how do you get into hand therapy if you have no skills? But how do you build your skills if you have no job in hand therapy? Right. So it's kind of that, like, I'm stuck between a rock and a hard place type of thing. And so I really wanted to develop a program to help people do that. Every time I hire, I have to do a lot of training. And so when I first started doing it, I said, I'm going to start recording everything. And I started recording how I like things done, how I, explain it and stuff like that. So I've just built like this library. Instead of just training my own team, let me train even more people, and I can train people in my area. Pretty much if opportunities come up at my clinic, then people have the opportunity, instead of coming to me and saying, I know nothing, I have no idea how to do any kind of testing, they can now at least come to me and say, I know something.
Yeah, no, that's the problem that I feel, that as a small business and entities like us are pretty much going away. We are the anomaly. Yeah, it is, except the reality. Come on.
Saba, don't say that.
It is all corporations. People don't want to take the risk. And actually now, the way it is getting with insurances, it's so hard unless you stay on top of it. Like, it's so much headache that as an owner, you cannot shut it off because there is always something going on. And most people are not up to that. And it's really not worth it for the money that you get these days. So what you got like 10, 15 years ago was totally different. For the amount of, and the administrative work is more, that you are actually spending more time doing administrative work than actual therapy. So that is one aspect of it that I don't recommend anybody to get into private practice anymore. And so ours is like literally an anomaly, a dying breed, you may think. That is one part of it. Second, our pockets are not that big that a corporation can offer. Like a hospital system, their payment system is totally different because they offer beds and things like that, which is so not fair. What they get paid compared to what we get paid. And so since we get paid less, we cannot offer what we can to these new therapists who want to be hand therapists, but there's no way to go about it. Schools and OT, it's like a vast field. They don't even cover anatomy physics properly. And so they come to you with nothing on hand, and now you have to, start from scratch, and you don't have the money that you can offer to them. So the only resource that you can offer, you and me, people like us, is teaching them.
Yes.
You can educate them, get them better, Only problem is as soon as they learn, they want to go for work for the big guy.
Right. So
You know,
yes.
you keep
Yep.
doing the same, reinventing the wheel over and over again.
Right. That's why I started filming everything. I've created a library, and it's not only for my staff and the people that I train, but it's to help all these other people who are from all over. Like, I've been talking to so many people in other countries as well that say the same exact thing. Like, when I started opening up my bookings to book calls with people and stuff, I've been hearing the same thing that I've been hearing in the US this whole time. And so there are people who, there's always pros and cons to everything, right? So there's pros to working in private practice, and there's not so great things working in private practice. It is a lot harder. It's a lot more thoughtful. I train my staff to be a certain way because we don't just rely on just people walking through our doors.
Yeah, exactly. What I call it, you don't have a built-in practice that doctors have to refer over here. No, they don't get dinged if they don't refer to us, but they get dinged if they don't refer in-house.
Yeah. So
the whole system is wrong.
Yeah, and it's just a different way of practicing potentially. So we practice a little different. We do private pay. We're out of network. Different things like that, and very different. But what I can give that other places can't give is what that person has to ultimately decide. Yes, Hoang doesn't always pay like a ton, and there's accountability to it. There's accountability. Like, do you have the potential to? Absolutely, but there's got to be money coming in order to have money go out. It can't just be money going out, because it doesn't. My pockets are not lined with money. But
that is true. That's exactly what I tell my staff. Is like, if you don't make money for me, I can't give you a raise, or I can't give you, so make money so you get more money.
But there's a potential here. I worked in a big hospital, and I know how those people work. Like, you come in, your salary might be a little bit higher, but it's really not going anywhere fast. And no matter what you do, you can do all these great things, but it's not necessarily going to give you raises, or it's not, unless someone leaves, and then that's the only way you can move up. But sometimes when you ask for stuff, it's just a no. There's no, you don't understand necessarily the reason behind why they're saying no, but you as a private practice owner can choose to lead your staff in a different way, and they have to want that kind of leadership versus the other type of leadership. And the other thing that we offer, I think that we have the benefit of potentially offering, right, is that mentorship. That ability to say, oh, you can come and ask me questions, or we can carve time in your schedule, for everyone's schedule, time to learn and time to get better. I don't know about you, but when I worked in a big corporation, it was all about like tons and tons of patients. When you work in a big hospital system, it's a little bit easier, but there's also a lot of red tape. It's just like a whole different animal. And sometimes there's no potential for growth. So if you're somebody who's like a little bit hungry for growth, a little hungry to do different things, like that might not be there for you.
Yep.
Right.
That's exactly how I see it. And I actually offer not just ongoing, if they get stuck with a patient, they send me a message. It's right then and there. We review x-rays, we do everything. So they learn, in schools, how many of them are taught how to review x-rays? But teach them how to read x-rays, MRIs, all those things. We even now have an ultrasound unit. That's awesome. And which during COVID worked wonderfully, because nobody was getting x-rays done. Guess what? My ultrasound came in handy. Whether they were healing, not healing, what was happening.
That's great.
Yeah, so there were, besides the mentorship is another thing. So they come in to learn. Basically, that's what I'm offering. And I offer actually official mentorship as well. If I don't have a job to offer, I will then offer mentorship, which right now I actually have a student right now.
Cool. See what happens, Saba? We just dove in and started talking. So before you go anymore, tell everyone who's watching. So the reason why I created the show too was to inspire occupational therapists, physical therapists who want to get into hands. So sometimes they see people like us in private practice and they wonder about, what is possible for them, or they see us as occupational therapists and certified hand therapists and they see what's possible for them, and that's like this goal that they want to be able to achieve, to work in a certain environment or to have certain credentialings. So that's one of the reasons why I developed this show. The other one is to share skills. Like, we all have different skills, kind of the same, but different at the same time, right? There's things that we do really well. So that's the whole point of the show, to share. So tell everyone a little bit about you. So we know that you have 2 clinics. Tell us a little bit about that. And I think that you have another business, don't you?
Yeah, actually I do. So my background is I come from India. I did my OT schooling in India. And then I came over here and I did my fellowship training in Texas with it was a combination of TW, Health South, and Baylor Alliance. And those 3 paired up to provide this fellowship, which was designed by Dr. Lichtman, and then run by Dory Tarrant, who was the ASHT president at one time. So I did that, and then finally I ended up moving to California, and I started my practice. Ended up having 2 practices. Right now I have 5 therapists working for me. So, it's doing quite well. In addition to that, I also partner with Ashim Bakshi. He is out of Indiana. And we have these hands-on courses. A lot of times there are a lot of webinars out there that you can look, but nobody will tell you whether you're doing it right or not. So a lot of times, those hands-on skills are so important for what we do, because if you don't palpate, if you don't know what you're palpating, your assessments are going to be totally incorrect. And if your assessments are incorrect, forget about treatment. And then going and talking to the doctor that this is what I thought it was when you're totally wrong, you don't want to make a fool of yourself. Even one therapist who makes a mistake looks bad for every one of us. So that is my goal, that I don't want any of the therapists to do something like that, because it's not just them that, that it affects. Then surgeons think all therapists are totally stupid. So that's the other thing, that that was the goal, to start those advanced rehab seminars. So we have like 10 courses that we have designed, each one different from the other. And you can find those on advancedrehabseminars.com. Before that, before or somewhere around that, I also was the president of the Hand Therapy Association of California. And
awesome.
I was that for 2 years. And then during that time, I realized there was not a single big conference that was happening on the West Coast. Everybody had to go to the East Coast to attend anything. So we started doing that, and apparently, I did it for 9 straight years. So wow. I would pick a topic, and I would, invite, because we have Stanford, UCSF, UCLA, all these big, big organizations. So we invited all the surgeons, sometimes from, outside of California, even overseas, and they came and they presented, and we did a 2-day course with, you name it. We got very creative during the 9 years. And then I got to a point where I'm like, somebody else can take over. I've done enough. So,
okay, awesome.
Yeah, so I did that. So that was I wouldn't give anything up, even though it was way too stressful and it's like a volunteer work and everything.
It's a lot.
It was so worth it. Yeah.
You got to learn so much. And in that time, how long have you been teaching your courses? So I know you shared your website for those courses. I'm going to include that link in the description. So anyone who's watching it, no matter when they watch it, they'll be able to find your programs, so they can learn from you, like continue to learn from you. Cool. So when did you develop your courses?
So I think we started in 2008. We did a course, not a course, we did a tips and tricks for ASHT at one point, and on differential diagnosis, actually, we did it for that. And the whole idea was just to show quick ways of doing a differential diagnosis. within 2 hours, that's what we did. And it went so well, and we got such positive feedback that it was after that we decided, it's like, oh, based on the comments is when we actually did the whole advanced rehab seminars as a 2-day course, which offered not just assessment techniques, but also all the way to treatment. So even if a therapist didn't know anything, because all of our courses start from surface anatomy. Yes. So, we go from surface anatomy, clinical reasoning, critical thinking, how you don't need protocols to do anything. You should have a way. Sorry, but I am not a big.
I love that.
It drives me nuts that people want to open a book and say, oh, this is a tomato, I need to put a tomato at 4 weeks. It doesn't work like that.
I completely agree with you. When I teach, you and I are very similar in that I think if we teach how to think through stuff, you won't necessarily need that protocol because you can problem solve through any case. I say that all the time.
Exactly. If you know principles of healing.
Now, I do see the need for protocol books for like a lot of people who they just, they want to be able to go somewhere really quick, jog their memory, or if they're newbies, I think that a lot of times it helps give them guidance. The only thing, it's guidance.
Yeah, but for me, even that is a big no, because they get dependent on it. And the way I start them is learn healing principles. If you know your healing principles, if you know how connective tissue works, if you know tendon healing, bone healing, ligament healing, all the healing principles, you have to know at what week, what starts to happen, when is proliferation, when is maturation, all of that. You can design your program. Then you have to put into account, it's like an algorithm. You have to put into account, okay, are there comorbidities, right? Diabetic, blah, blah, blah. Okay, put that into the equation. Did the wound heal on time? Put that into equation. And then you figure out, and then learn to read x-rays. Why can't you read x-rays? There is no reason. We've come this far. We've trained ourselves. We've observed surgeries. We've shadowed surgeons in the clinic, and we've learned how to provide better care for our patients. This is another step towards it. Learn to read x-rays. And there are so many resources out there that can teach you how to read x-rays, what it takes. You may not be perfect. That's okay. When I first started, I used to, go to the surgeons like, I don't know what you're looking at.
Yes.
Help me understand. MRIs were like dots, black and white dots to me. Right?
Shades of gray.
Exactly.
Shades of gray.
Exactly. So, and there are surgeons who would take the time and teach you, find those mentors for yourself, and they will train you, they will guide you, Don't be scared to be dumb. There were times I had, like, I remember this one case, and I was reading the op report at 11 o'clock at night. I didn't understand. The patient was coming in the next day. I emailed the surgeon. The surgeon replied right then and there at 11 o'clock, right? I said, I still didn't get it. So he, again, literally explained the whole thing to me. We were going back and forth via email at 11:30 at night. So there are surgeons who will take the time, who want better results, and who will train you. So find those people.
Yeah, absolutely. I always say that you got to raise your hand, right? You got to raise your hand, ask the question. How long you been practicing, Saba?
As a therapist?
Yeah.
Oh, do I really have to tell you that?
A long time. Double digits? I'm double digits. So
big time double digits.
So I've been practicing 20 years. No. And one thing that I always tell therapists, though, you'll see therapists who are, want to get into OT or want to get into hand, or, so there's people all along the journey. So people who are CHCs, people who are like, you and I with many years, we still have something to learn. And so everyone's got to learn in their pace and wherever they are in their journey. And so it's not like when we say like you should learn these things, or you can, the potential to learn these things are there. It just doesn't necessarily mean it has to be right now, it has to be today. But as long as you're taking those, I would say, little small increments of steps, so that you can keep growing and continuing in your learning. Because you come out of school with the basics, and then it's up to you as a therapist to say, okay, I like this. And I highly believe in being a well-rounded therapist. I did a lot of different areas before I landed in hands. And so everyone's got their own pace in which they go. But regardless, you find that area that you really love, and then you say, okay, I'm going to now dive into this.
Can we pause for a second? I had told one of my therapists that I would help her with this patient, and I didn't realize it was the same time.
It's okay.
The problem is the surgeon is not a hand surgeon, and he's doing, we think he was doing tenolysis, but then he wants a dynamic splint after tenolysis, which makes no sense. And so this therapist of mine, and we don't even know if he's really doing tenolysis or if he's going to do tendon repair. God only knows. Yeah. So yeah, so that was, and she was asking me what should I do? I said and they wanted it made before the surgery. And I'm like, oh my God, these guys they have zero idea how these things work.
How do you talk to those surgeons to let them know what you recommend?
So in this case, because I don't know the guy, and it was everything was coming through workers' comp, and they didn't even know what they were talking. They wanted a Dynasplint. Dynasplint is very different brand, and dynamic splint is very different. What does your guy want, right? And then I even said because I need the op report to even design the program. So a lot of times if I don't know the surgeon, I'll do what he wants me to do because they get pissed otherwise. But then I'll start with that and I'll change the program right away. Because all they care in the end is that the patient get better.
Yeah, they just want results.
They just want results. So, if I can't talk to the guy and if he's not even getting what I'm trying to, because I literally tried to explain the whole thing. And nothing was going through, and I said, this is a waste of my time, and
they don't understand. But that's cool. From your courses that you do, what is a popular one when you have people coming to you, like therapists coming to you and saying, I need to learn hand therapy? What's the one course that you direct them to?
So if they don't know anything, like literally they're newbies, then we have a manual therapy course. So which starts with fully drawing out surface anatomy, hand placements, doing the mobs, all that, and then soft tissue mobilization. So it's both joint and soft tissue mobilization. We don't teach neuromobilization in that one because we have a different course for that.
Okay.
That's
a whole nother animal.
Exactly. And we gave a talk at IFSHT in Berlin. And after that, we designed that neuromobilization course. We did that with Dr. Haggard and Dr. Curtin in Berlin. So that went really well. So after that, we have this whole how to do, because the whole concept of nerve glides, right? Where you can just do nerve glides and it should just work. Well, what if they're trapped? There is adhesions, things like that. Yes. How do you know if the nerve is truly gliding? And then how do you design the exercises based on that? So we do this whole thing about assessment, how to assess where the nerve is entrapped, because you don't just treat carpal tunnel here. Carpal tunnel is like the nerve in continuity, and you have to treat accordingly. So, doing that and then using the myofascial techniques and then nerve glides and then combining them. It's a full course that we actually teach on that. So nerve glides are separate. So if they want to start, manual therapy is it, because you need to know your basics. If you don't know your anatomy, your hand placement, all that, you cannot go anywhere else. The second step is differential diagnosis. So this weekend, actually, we're doing a hybrid. This is the first time we're actually doing a hybrid course where part of it. I was
just about to ask you, because normally I was supposed to ask you because normally your classes are live courses, right?
Exactly. And this is live. This is live.
This is live.
It is live. We are doing a very new concept. because
Love it.
we had to figure out something with all the COVID going on, because I quarantine even my patients. If they fly, they cannot come to my clinic for 14 days. So
Right.
how do we get these patients, therapists who want to attend the courses, attend via being safe and all that, right? So there are some therapists who are attending in person that they can
Yes.
practice on each other, and they have to wear masks and all that stuff.
Of course.
And then some of them are going to attend via Zoom, and they're going to pair up with somebody, or they have to show the techniques to us via Zoom. And so we're going to monitor that. So one instructor is going to monitor that one.
Oh, that's so cool. That's a really neat way of doing it.
Yeah, we don't know how well it's going to go.
Oh, stop it. It's going to be fabulous. Like,
Yeah,
so
sure.
really, it's going to be fabulous. So a lot of people are like, I've been in some of the groups and they talk about CEUs and all this stuff. My programs currently don't provide CEUs. I do a lot of online, stuff, but your courses do provide CEUs. And I think it's great because people are looking for opportunities for live courses, because there's an aspect to online do it yourself, and I have some of that. And then in mine, I have some like live stuff because they're all like phone calls, accountability, mentorship types of calls. And so they're getting that live portion in the way you're doing your program, where they're following the steps with you, and they can answer, or they can ask questions you can answer. And that's really important, because sometimes you're reading and you're like, I don't really know.
And then and with we do, whether you're doing it correctly, and that's the whole point of the hands-on, the mentorship type thing. So that is our second step. And then for some of the experienced ones, we did this one where it was problem solving. So taking the most difficult cases, giving them as that's like, okay, here's the case. Where would you start? Everything is stuck, like shoulder, elbow, wrist, hand, you name it. Where would you start and how would you go about it? Right. So the way we did it, and that requires a lot of interaction between the attendees and the instructor. And it's like they just put it down, they just spit out whatever you want to, and then we help them guide through as to why this is good, why this is not good, how you can solve. So each step of the way you solve problems, whether it's from an exercise point of view, manual therapy point of view, a splinting. So we take them step by step and then design those programs. And they bring their own cases and things like that, and we solve it. Basically, it's all about problem solving. And that was a fun course to do, because that is where your skills matter, right? A simple carpal tunnel comes in, the surgeon doesn't even care, right? I mean, but if it's a difficult case where they had difficulty doing it, that's where your skills matter. And that is where you need to prove to the surgeon, you know what you're doing. And that is what we teach how to, and again, no protocols. There's no protocol for something like that. So you figure out based on principles of wound healing, bone healing, you have to have your anatomy down, your pathology, and biomechanics. If you have these three things, and then you do clinical reasoning, you can actually design every program. And that is what all the advanced courses are about.
Okay, so awesome. So I think a lot of people watch this that are a little bit more on the beginner side. So what is one thing that you could share with someone who's just starting out in hand therapy, and like the one thing that you always teach your staff, or something that someone can take from this video, from this show, and use right away in a patient of theirs?
Use it right away.
Use it right away.
Well, for my students and staff, one thing I always tell them, get your anatomy right.
Okay.
If you have your anatomy, then you can apply whatever comes in front of you, because you can assess, you can figure out, and then you can treat. So in terms of, one skill, I would say it's your manual therapy skills.
Okay.
So you need to make sure that if you have your anatomy right, you get the manual therapy techniques down, because most of your patients are going to be that category. You know how your assessments and things like that. Because if you have that down, it will be a piece of cake.
So for example, let's say you have someone who is really stiff in their fingers. Is there like, you have your P1, your P2, your P3, let's say it's a fracture. I see tons of fractures. I'm sure you see tons of fractures and they're stuck. What is the one thing that you use, that you teach a lot, you teach your staff to use that could help to move that knuckle better?
So if you give that as an example, then my thing is look for the end feel, right? A patient came in, how many weeks out is it? Fractures healed, that's not your problem. The problem is the joint is not moving, it's stuck, right? And if there is a give in the end feel, then you can design the treatment accordingly. Is it just exercise that they need? Is it splinting that you need to add to it? Or is it so stuck that you need to add casting? Serial casting, and then you get it going, and then go to the next step and the next step. So those are like, if you know how to assess for end feels like in a joint, then you can guide your treatment properly. So that is how I would.
I'm gonna dive in and I'm gonna pick your brains up. So if you have like a firmer end feel, how long do you cast them for? So if you're a believer, like you do plaster casting and stuff like that, you do plaster casting?
I use the quick cast. I quick don't cast. Like messy stuff.
I use a quick cast too, but I started doing a little bit. I was reminded I had all the supplies and I started doing plaster casting as well. So you do quick, like how long do you leave that cast on?
So if you look at research, and I'm a big believer in like reading up articles and good articles.
Oh, thank God for you. Thank goodness for you. That's why I would take your class, because you read the articles for me.
Yeah. Well, actually, once a week, all my staff has to read one article and present to me. We do a meeting every Friday that all my staff has to read up stuff. My whole goal with them is to get them to understand what a good article is, what to look for in the article, and how you would apply that research into practice. Because that is what sometimes is missing, because people read it and it's like, okay, yeah, but they don't know.
I feel like I should work for you. Like I just have staff meetings and we're like, if we do the staff meeting at the end of the day, we can have a drink.
Well, so this is our usual Friday lunch meeting where,
you're like, no drinking, staff, no drinking. Don't listen to this video. We have patients afterwards.
Yeah. So what was I trying to say?
That your research. So what does the research say?
Research based, yes. How long, right? So there is that weeds research where, you splint it for 3 days. And then after that, when you resplint, so if you read the research, you can actually get a better result if you kind of splint for 3 days and then get the patient back, and then you stretch it out a little bit more, because the tissue gives, right? And it's not going to give any more than once, whatever is proven by research that it gives. So you may want to redo the stretch after that many visits, after that many days. Yeah. So basically, read research and apply the research in your clinical practice. So it's like, if it's a cast, you apply the cast, get the patient to come back, take the cast off, do manual therapy, stretching, whatever you want to do, get it in as best stretch position, and then recast that patient, and then get the patient back again. So that's how you can actually see incremental progress that the patient is making. And if you don't see the progress, that is also another thing that I always tell the patient, not everything is your cup of tea. If you're not making progress, either you're not doing everything right, or you need to send the patient back to the surgeon. So you have to figure out which bucket it falls under, and then send the patient.
Yeah, I do quick casts too. I love it. Sometimes it's not, like with the really stiff ones, you still do quick casts too?
I do, because what I do is I make the 2 loops around, like, suppose if it's PIP joint, right?
Yeah.
So you make
it's always a PIP joint.
Exactly, I know. And so you kind of let those harden, and then I take my 3rd one, and then I really work it. Yeah. So with the dorsal glide, you can actually get that in place.
Yeah, I like quick casting because they can wash your hands and
it's lighter. The compliance is much better. So they actually like it, and they don't mind having that. The other casts are so heavy, then they come with some new problems.
Yeah. There's always a new problem, but I think that's why we have jobs, because
I know. One of the things I always joke with, because I live in an area where it's all engineers, right? It's Silicon Valley, right?
Yes.
And then they always like to say is like computers were the best thing that happened for mankind, right? I'm like, I don't deny it. It gave me job security.
Yes. It really does. Oh, I have a friend who has his clinic there, and he's very much into sports and stuff like that. He rehabs like sports people. Do you find that your engineers are a lot more analytical and they want those numbers and they want those like where's the
Tell
research?
me about it.
And then certain areas are like, no, I just want to feel it. I just want to feel it. I think I'm in the feeling people. I think I'm in the feeling area. Like, I don't feel it's like it's raining. I feel like I'm gonna stay home today.
When I lived in Texas, it was all about the feel because they could tell the weather changing, and they were a barometer basically. Here in this area, it's kind of funny, and I think I got more into research and reading research and applying that because of these guys. Because you have to kind of talk to them with research, with data. Because if you have the data on hand, then you can actually, tell them this is what data tells me, right? And the moment you say that, they're on board with you. So so you can go wrong.
Oh, that's awesome. That's really awesome. Well, Saba, thank you so much for sharing your time. I know you're a busy woman, 2 clinics, lots of staff, a second business. I mean, and what I'm going to do is I'm going to make sure that everyone knows that your courses are available, and the 2 that you recommend, and anyone who's looking to develop your manual therapy skills, if you're starting out, like Saba says, your manual skills and your anatomy skills, those are classes that she has available for you.
Cool.
Thanks.
Thank you.